Start.
Okay. Good afternoon, our delegates in Africa, Middle East, India, Pakistan. I don't know where all you are from, but it's a big pleasure to welcome you to our postgraduate diploma in ART and reproductive medicine, which is now running from 28 till November 1. So we are having, at the present time, three of our speakers present. And I will just try to introduce myself first and then have the others say hello to you. And we kindly ask our organizer, Mr. Yasin Mirza, to put the list of participating countries in the chat.
It is there.
Already there. Oh, wonderful. So then we can see where all you are from. So I'm Dr. Professor Lieselotte Mettler from Kiel, Germany, and have been in the field for quite a while. In reproductive medicine and gynecology, we had our first test tube baby in 1982, and I spent 6 months in the physiology department with Robert Edwards in Cambridge, 2 years before that, so 76, 77. The time is long, and we are ready to share our knowledge with you. I'm at present the deputy director of our IVF department at, we call it Kinderwunsch-Sprechstunde. We just say it's a consultation to have babies at the University Clinics of Schleswig-Holstein, Kiel, from where you will also get your diploma. My co-organizer and chair is Dr. Minu Agarwal from India, Pune, India. Minu, please welcome our delegates.
Yes, thank you, Lilo. Good evening, everyone, and I welcome all of you to this 5 days feast of on ART. We are all privileged to be with Professor Mettler, and when she says she has been in IVF for a long time, that means she has actually been associated with the first IVF baby born in Germany. So it's a privilege for us. She's a teacher of teachers, and we'll be learning a lot from her and other colleagues of ours. So we have a good faculty lineup, good set of lectures, and we are all ready for you. So thank you very much.
Thank you, Minu. Dr. Minu Agarwal runs a very active fertility clinic in Pune, India. She will support our course with some live surgeries on the Friday or whenever, I'm not sure, I think Friday. And so she will be doing some surgeries, follicular puncture, embryo transfer, hysteroscopy, whatever is available for you all to participate in. Then it's my big pleasure to welcome Professor Ali Salmasi, who has been 25 years the head of our embryology laboratory in Kiel, Germany, and is living now near here and partly helping us still. So, Ali, please say a welcome address to our delegates.
Oh, welcome to everybody. I was the head of IVF laboratory and worked with Professor Mehta together. And now it is a pleasure for me to be in this postgraduate diploma. And I will then show you my lectures and introduce me today.
Thank you, Ali. Yasin, as organizer of AECS, thank you for organizing everything. Would you like to say something to the delegates?
Yeah, I just want to say for every lecture, there is a question answer session. There is a QA box. So everybody need to write a question in a QA box only, not in chat box. Okay, for any technical things or any other things, apart from the question, you can put in a chat box and we will take care of it. And for every day session, we will send you the recording tomorrow morning, every day, like which is valid for 48 hours. And you need to check your email. And if you didn't find an email, you check in spam as well. Instead of writing us back, we didn't receive it, you need to check in spam as well. For every day, you will listen again. If you miss anything, or if you want to repeat it again, you can see and watch again. And I think it's like, and at the end of the course, after a couple of days, we will send you the certificates through email, and we'll also share some of the presentation from the speaker as well.
We also will have an examination at the end, and pass a certain percentage of these questions, which I hope you all will after the different lectures. So two of the speakers of today are not yet with us, Dr. Karuna Kamarikinti from Dubai and Dr. Gaurav Gandhi. The picture is here already of her from Mumbai. So we have the pleasure of starting right away, and I will take the first lecture, which is an introduction, and then right in medias res. So 4 decades of IVF. 1978, Louis Brown was born. 1980, we started in Kiel, and 1982 we had our first test tube baby. Till 2020, 40 years, 4 decades. History, reality, and future aspects. What are we dealing with, and what are we waiting for? So we greet you from northern Germany. Kiel is here on the Baltic Sea. It's a sunny day, and still some boats out on the fjord, although it's 10 centigrades, not so warm. So this is our country. The capital, Berlin, would be here. And we look to different directions, to Africa, to Middle East and Asia. And it's our pleasure to have you here in this diploma of the University Clinics of Schleswig-Holstein. Our faculty spans its wings from Great Britain via Germany. We have one speaker from Great Britain, via Germany to Israel. We have one speaker from Israel, and United Arab Emirates with our organizers and one speaker. In the Middle East to India in Mumbai and Hyderabad. So we are spanning the wheel for quite a part of our earth, and we hope and pray that the present COVID pandemic that is all impeding us in many aspects of life will be overcome, and we pray for all patients that are suffering and hope they get well. Our little interaction for you will be carried by myself and Dr. Minu Agarwal, by Dr. Karunaka Marikinti from London, Dubai, Professor Ali Salmasi from Kiel, Germany, Dr. Gaurav Gandhi from Mumbai, India, Dr. Alpesh Dossi from London, England, Dr. Rishma Dillon Pai from Mumbai, India, and Professor Howard Karp from Israel. So it's a big group we have. Where do our delegates come from? Dear friends of ACS, please let us see a list telling us from which countries our delegates come from. I will just interrupt for a moment and play a video that brings us right into the action of the test tube baby. The first worldwide...
Sie hat Robert Edwards berühmt gemacht. Louise Joy Brown der Welt...
The first worldwide published video on test tube baby technique. Can you see it?
Yes, we can see it. We can see it, Lilo.
Open it again. Okay, I will open it again because I could not integrate it into the lecture, but it runs otherwise nicely. Okay. Now, again. Okay. So this was Louis Brown's birth in 1978. At that time, it was considered over the world a miracle. Steptoe, the clinician, Edwards, the physiologist, they had worked many years to come to that result of having a living, healthy baby. I don't know if many of you have seen the video, but that was Jean Purdy, the technician, embryologist. It was a wonder in medicine. That's how it was reported in Germany, in our journal, Der Spiegel, and everywhere in the world. It consists, of course, a cooperation of 50% embryologist, 50% clinician. And without this cooperation, it couldn't happen. The clinical work, the stimulation, the oocyte pickup, the embryo transfer, the delivery, all that is, of course, necessary. But in between, the fertilization and the embryo culture was the most difficult to develop. Robert Edwards in 2010 then got the Nobel Prize. And many technologies have come out of it. Happy ones, good ones, and also questionable ones. Finally, the Pope also gave his blessings, and that was a big thing. Louise Brown, meanwhile, has had children by herself. She has grown, and the whole technology has developed. And we are happy that she and her husband in the next generation didn't need IVF to get pregnant. So the mother needed it at the time. Cryoconservation, we will talk about that, has developed. freezing of oocytes, embryos, the intracytoplasmatic sperm injection has developed, and all this is a part. And Robert Edwards and Patrick Steptoe brought it to us. They were the ones that blessed us with it. Now we are celebrating in many occasions the birth of all the children after IVF. We had in the previous years once a year a meeting of all the mothers and fathers and their children. The laboratory has increased. We have more co-workers. We understand how important the laboratory is, and we give all the credit also to the cooperation between embryologists and clinician. So also in this course, we have tried to balance the clinical and the embryological lectures for you to get a good overview. It is the embryo that goes in, and that's the miracle that we are facing. There's the family, and we are thankful to Robert Edwards and Patrick Steptoe, who both are not living anymore, for the blessings they did by being persistent to develop this technique. And you do have to be persistent. It doesn't come by itself. And now I will go back to the lecture. Okay. So it's my pleasure to report to you about 40 years. How did I interact with all this? In 1972, at the World Congress of Fertility and Sterility in Tokyo, I met Robert Edwards and had a very good impression of that technology. My teacher, Kurt Sem, was talking on laparoscopies, but I thought, whoa, IVF is more interesting. Anyway, then in 1976, I did my research work that we call in Germany habilitation on the topic of IVF, but nobody was interested. To become a professor and to select such a topic, even my husband said, that is something very strange. Why didn't you talk about a surgery or anything decent? So the technique started, and in 1978, Louis Brown was born. The first IVF baby in Kiel was in 82. The Kiel School of did not have an implantation because this traveling in the in vitro culture needs very good protection. And this is learned today, how we can protect the embryos after cleavage, after fertilization, and how then a blastocyst can come into the uterus, and we transfer that on day 5 or whatever when we are ready, and how a blastocyst can implant. So this whole cycle took some time to understand. Now we have understood it. And according to Robert Edwards, he always said, you know, Lilo, the pregnancy rates after IVF should be higher than physiological pregnancy rates because we overcome all the obstacles. And he is right. We have reached a stage that with very good IVF cultures, we are reaching the physiological implantation rates. So in Germany, we have started the German Society of Fertility and Sterility under my teacher Kurt Sem in 1958. And it's now the Reproductive Medical Society. It goes on, and IVF is a step in it that has enriched everything. Many journals and societies have been founded. The German IVF Register, where every case we do is registered today, so there's a very good control. There have been many meetings around the world from the International Federation of Fertility Societies. Sorry. We had 2010, this World Congress in Munich. It was 2016 in Delhi. 2019, it was planned for Shanghai. It did not materialize because of COVID. And we had the ESHRE 2014 in Munich, and the ESHRE 2020. We didn't have, again, it was a virtual conference. So we are now in a kind of paused place, but we interact, as we can see in this webinar. In medicine, in these last 40 years, many developments occurred. So it's not only we in IVF. We had infection prophylaxis and treatment, medication production, imaging techniques really improved, microvasic surgery improved, reproductive medicine in ART, that's why we're here, prenatal medicine, huge advances in imaging and in recognition of disease and treatment, cancer diagnosis and therapy, luckily also some advances. So just the ultrasonic gynecology, if you take that and you that are doing 2 and 3D imaging, you know how well we can see uterus bicornis, how well we can see septum and all these other things. This is graced to very good imaging, how we can use blood vessels and recognize them and understand that there is maybe a malignancy, and particularly the fetus became visible. We can see the heartbeat at an early stage, which we couldn't imagine we will ever be able to see. And ultrasound in obstetrics even gives us the image of the child that's growing in the mother, and we can share that with our patients, the mothers, the fathers, and the family. So there's a big progress in this field, and we are going to give some lectures to understand. In my consideration, artificial reproductive technology stands on 4 legs. One is the male side, andrology. One is the female side, gynecology. One is the veterinary medical side, because we have learned a lot from veterinary medicine. And one are basic sciences: genetics, molecular biology, immunology, biochemistry, and embryology. So this is a cooperation of those 4 disciplines. Let me just briefly jump into andrology. Andrology has given us some medical therapies like profertil. We use tamoxifen, cryoconservation of ejaculated sperm, or testicular biopsy, and biopsy of ovaries have become a reality. Testicular biopsy in children before malignancy treatment. So there is a progress, and ART in men has helped, even if in heavy smokers, in patients that are on the lower level of fertility, to get pregnant by ICSI and TESE technique, testicular extraction or micro-TESE and intracytoplasmatic sperm injection we are going to mention many times in our webinar. So far for andrology. Now for gynecology. Ovulation induction, stimulation, regulation has improved. We have much better possibilities today. Endoscopic surgery with minimal invasive surgery with hysteroscopy, fertiloscopy, and laparoscopy has added a lot. Imaging techniques, 2D, 3D ultrasound, in combination with new energy sources, MRI-focused ultrasound treatment for fibroids, other medical treatments have come on the market. So laparoscopy, we are able to do many, many interventions as a good treatment for our infertile patients. In hysteroscopy, septum resection, myoma nucleation, polyp resection, arteriolysis, tubal catheterization, fertiloscopy, all has become possible. We understand better how to treat polycystic ovarian disease. We have a lecture on the last day on it, adenomyosis and endometriosis. ART, that is why we are here today, is a big part of gynecology. Fertility prevention in cancer patients has grown, and reproductive surgery is there for everybody. So in gynecology, sterility and infertility treatment, ovulation induction with different